Dr. Shade.
Hi, Mrs. Phillips. How you doing today?
I'm doing really good. I just still keep having this pain, you know. I've been taking the medication. I've been really good in taking the medication, but it really isn't helping. It's hurting a lot, and, you know, it keeps me up.
Has it been getting worse?
I think it is getting worse. It feels much more painful. It's, you know, I feel it all day long, and like I said, it's keeping me up at night, which is really hard for me because I have so many things to do during the day. I'm not getting rest, and it just hurts really bad.
I can imagine. I mean, it sounds really painful.
Yeah.
Have you tried anything for it?
You know, I've been just taking the medication, like you said, and you know, like I said, I'm really bad at taking medications, but I've been really good in taking my medications.
Yeah. And as far as any appetite concerns, any nausea, vomiting?
Yeah, I mean, the nausea has really kicked in since the last time I saw you, and I really have not been able to eat anything. I just don't feel an appetite for it, but I'm just continuously nauseous. But I think it's really the pain that bothers me.
I can imagine.
Yeah.
So you remember when you were here last week? We ended up sending you down for a CT scan.
Yeah, I wasn't sure why we, you know, did that, but yeah, I remember going down for the CAT scan.
And as far as when you went down there, they treated you all right. It was easy.
Yeah, it was. I mean, the staff here is wonderful. They told me what I needed to do. I mean, there was so many questions going through my head of why I was getting the scan in the first place, but the pain's so bad that, you know, I think maybe you'll find something on the CAT scan. Did you find anything on the CAT scan?
So that's actually what I wanted to talk with you about today, and that's why we set up this appointment. So the radiologist and I have been talking, and I had an opportunity to go through the films with him, and what they ended up finding was a mass in your stomach, and
does that mean I have cancer?
So what we're suspecting cancer, and one of the reasons why we're suspecting it is because we found the mass in your stomach, and then we found some other things in your liver as well. So we're definitely, well, while we don't have a diagnosis completely on the books yet, it's looking like it could be this way.
Wait, I'm so young. Are you sure? Is that...
So, while we're not 100% sure, it's looking like that this could be cancer.
I mean, I'm so young. Why would I mean, I've never smoked. I've never drank alcohol. I try to eat healthy. You know, how are you sure that this report's my report?
Yes, we're pretty sure about that. We
I mean,
checked.
what did I do did I do something to cause?
No,
I mean,
not at all.
Okay.
Not at all. You did nothing wrong here. I just wanted to let you know that first of all. And
does this mean I'm gonna die?
No, not necessarily. We have to explore all of the options first in terms of what type of cancer you might have, what type of treatments are available for this cancer, and I just want to let you know, as far as that process goes, I'm going to be with you every step of the way, whatever it is you decide.
I don't think is this really happening?
It's very hard for me to talk about this because you're young. I mean, you have a life ahead of you.
I feel stuck. I feel like I don't... I mean, how did I...
That's one of those things. I mean, there's no easy answer for that. I mean, there's no answer for why, I mean, someone as young as you should end up with this type of cancer.
Okay, and so... Sorry, I might have blanked out.
No.
Where can we go from here? What do I need to do?
So the first thing that we want to do is to get a biopsy. So we would send you down to radiology, and they would do a biopsy of one of the mass in your stomach, and then we would identify what type of cancer this was, and then after that, I would talk with you about all the treatment options that are available, given what we're able to identify.
This is so painful already. Is this how I'm gonna pass in all this pain?
No. We want to make you as comfortable as possible if that's the route that we have to go down. But at this point, I don't think that we should be talking about that quite yet. I wanted to ask you a little bit more about your family. And that's actually the most important thing for me the next time you come in. Do you want me to talk with your husband and your children about what's going on?
I mean, my ex-husband is not really involved in my life. My kids definitely are. And then, I have a significant other right now.
All right.
My fiance, I just don't know if I'm ready to tell them yet. I think they're going to be heartbroken.
I completely understand. I mean, especially in your situation. And is there someone that you feel really close with that you can talk about all of this with?
I think the best thing to do would be talking to my fiance before I go talk to my kids.
Absolutely. And I just want to let you know, if you want to talk with him in private about the situation first, before having a family meeting, I completely support that.
Yeah, I just don't know how I'm gonna tell him.
I know, I mean, that's really hard. I mean, it must be really hard to be in that situation. I just wanted to open up the floor a little bit and ask you if you had any questions for me.
Is there any chance that this could be cured?
Well, the first thing that we have to do is figure out exactly what type of cancer this is. We know that the mass is in the stomach, but different types of stomach cancers have different prognosis. So some have really good prognosis, some have really bad prognosis. So the number one thing that we have to do is figure out exactly what type of cancer this is. And I just want to let you know that I'm really sorry for having to break this news to you.
I'd rather have it be you.
Thank you. And I just want to let you know that we can set up an appointment for just to follow up on the results of the biopsy next week.
Yeah, I might. Will you have availabilities if I want to bring my fiance in before that?
Absolutely.
Or even before I get the biopsy?
Absolutely.
That would be okay.
Yeah, I mean, anytime we can set up availability and we can talk about everything that's going on.
Okay.
All right?
Yeah.
All right.
Thank you.
I'm really sorry,